And we're back with Sammy Leach with the North Carolina Navigator Consortium. A reminder, you can call the number that's there on the corners, 855-733-3711. You know, a lot of people who may be watching today have an ACA marketplace plan, and they think to themselves, well, I liked what I had all this last year. I'm just going to let it re-enroll me automatically. Right. Why would you tell them not to do that?
Because we have more competition in terms of insurance companies than we've had before. I know it used to be we had just about 4 per county. Now we're up to 5, a little over 5, but also 9 insurers across the state of North Carolina, which creates a competition, which means that they want to make insurance affordable for you. They want to make sure they can sign up as many insurers as possible.
Which means some of those plans have probably changed,
Oh yeah, some of those plans could get tweaked and changed depending on what you're going through in your life, because you know a lot can change in a year, like you said. But you want to make sure that you are getting the most affordable plan that you can, and it's meeting all your requirements and criteria that you want.
Right, the doctors you want to see, the prescriptions that you have to take, all those kinds of things.
Exactly.
All right, so the experts that are behind us on the Zoom call, they're waiting to take your call. You can ask them anything about ACA or about Medicaid as well. And again, that number 855-733-3711, okay? So access to healthcare in rural areas, it can really be a struggle out there. A new investment is hoping to change that. Wake Forest University will use some grant money to work with doctors to find more solutions. WFMY News 2's Denise McMiller gets a healthcare worker who talks about the struggle firsthand.
This is one of our typical exam rooms.
Frank Everhart has worked in the medical field for more than a decade. He's made it his mission to help uninsured patients get their health back on track.
The appreciation that we see in them is humbling to be able to be a part of that.
On a typical day, Everhart sees about 18 patients at Davidson Medical Ministries in Thomasville.
We've got patients that come from Denton. I have some patients that come from as far away as Moxville. A couple in Level Cross. Some patients will come in and they haven't had their meds in 2 or 3 months, or they may have been years without having seen someone.
Everhart says Medicaid qualifications or 2-hour bus commutes often prevent patients from seeking help. That's why they're introducing a mobile unit at the start of the year to meet people where they live. But finding doctors willing to work in small towns is a struggle across America. Studies show the United States is on track to be short 124,000 physicians by 2034. That could hit rural communities like Davidson hard.
We've had positions that have been open that it takes longer to fill because we are in a rural community. Eventually we'll find someone, but then they're traveling from one of the urban areas to the rural area to provide care, which we're thankful that they're here. But it makes it more difficult for that attraction.
To turn this projected trend around, Wake Forest University School of Medicine will use grant money to study and understand why there's a lack of physicians and come up with incentives and policies that would attract more clinicians to rural communities.
And a lot of that cost and burden, especially on the emergency rooms and the wait times in emergency rooms, it would help to alleviate a lot of that. So that would be exciting. Having someone local, close in the community.
Everhart is an example of a much-needed physician rooted in the community.
Being in the smaller town, again, it's like treating family.
In Davidson County, Denise McMiller, WFMY News 2.